When we first began our discussion of the cardiovascular system, I mentioned that there were three major components that comprise the cardiovascular system: the blood, the heart, and the blood vessels. So in this chapter, we'll learn about the heart, which is a pump that circulates that blood that we've already talked about throughout the body. For blood to reach body cells and exchange material with them, that blood has to be pumped continuously through the body's blood vessels. So the heart beats about 100,000 times a day, which adds up to about 35 million beats in a year, or approximately 2.5 billion times in the average lifespan. So we'll learn about the different parts of the heart and how it works to move that blood throughout the body, and how the left side of the heart is going to be the pump that sends blood through blood vessels out to all parts of your body except for the lungs. That's the responsibility of the right side of the heart. So we'll learn how the right side of the heart enables you to pick up carbon dioxide or pick up oxygen in the lungs and get rid of the CO2, the carbon dioxide. So in this chapter, we'll explore the structure of the heart and many of its properties that allow it to function as a pump throughout your lifespan. To be such an important organ in the human body, the heart's relatively small. It's about the size of your fist, not the same shape, but about the same size. So it's about 12 centimeters long, or 5 inches, and about 9 centimeters or 3.5 inches wide at its broadest point. About 6 centimeters or 2.5 inches thick, with an average mass of about 250 grams or 8 ounces in adult females, and about 300 grams or 10 ounces in adult males. The heart rests on the diaphragm near the middle of the thoracic cavity in an area that we call the mediastinum. So that's just an anatomical region that extends from the sternum to the vertebral column, from the first rib to the diaphragm, and between the lungs. You should have learned this in your Anatomy 1 class, right? So about 2/3 of the heart lies to the left of the body's midline. So you can visualize the heart sort of like a cone lying on its side. The pointed part of that cone, or the apex, is formed by the tip of the left ventricle, which is one of the lower chambers of the heart, and it rests on the diaphragm. Now remember back when you learned your major body cavities in Anatomy 1, the diaphragm was that broad sheet muscle that separated the thoracic cavity from the abdominal cavity. So the apex of the heart lies there on that diaphragm. The base of the heart is the opposite of the apex, so it's the broader upper part of the heart, and it's formed primarily by the atria, and also some of the large blood vessels that we'll look at are going to be attached to that base as well. Next, we'll look at some of the coverings that surround and protect the heart. Those are called the pericardium. So the pericardium confines the heart into position there in the mediastinum, but allows for sufficient freedom of movement so that those continuous contractions of all that muscle can happen without friction. The pericardium consists of two major parts: the fibrous pericardium and the serous pericardium. Again, I'll ask you to remember back when you learned about serous membranes in your Anatomy 1 class, and you found that serous membranes were made up of epithelial tissues that secrete serous fluid into a cavity. So the superficial fibrous pericardium is made up of a lot of tough, elastic, and dense, irregular connective tissue. So it resembles sort of a bag that rests on and attaches to the diaphragm that holds the heart. The fibrous pericardium prevents overstretching because there is very little elastic connective tissue. As I mentioned elastic a while ago, I meant to tell you there's very little elastic. Anyway, so because it is so fibrous, it prevents overstretching of the heart and is able to provide protection while anchoring the heart in that cavity we call the mediastinum. Deep to the fibrous pericardium, we have the serous pericardium, and it's much thinner and much more delicate, and it forms a double layer around the heart. So the deeper serous pericardium, the outer layer of the serous pericardium is called the parietal pericardium, and it's fused to that fibrous pericardium. The inner layer of the serous pericardium is also called the epicardium, and it lies right on the surface of the heart and sort of hugs very closely to it, very much like if you have a roast and you wrap it in saran wrap, how that saran wrap will lie right on the surface of that heart. So if we look at this particular image that we have here, if this is the pericardial cavity, peri means around and cardi refers to the heart. So the two parts of the membrane are going to make up the serous pericardium. But if we take the heart and we start squishing it down into that serous pericardium. Now we didn't open the pericardium, we're just pushing down onto that serous pericardium. So part of it is coming up and is going to wrap around the heart itself. Very much like if you were, pushing your hand down into a balloon that you had inflated and tied. Some of the balloon would wrap around the surface of your heart and the rest of it would be the outside and lining the cavity. So that's exactly what happens with these two serous membranes. The heart is surrounded by the inner part of that serous membrane, which is the visceral pericardium. Remember, viscera means organ. The outer part of the cavity is lined with the parietal serous membrane, the parietal pericardium. Between those two layers is the cavity. So that is your pericardial cavity, and that's going to be filled with serous fluid that is secreted by both of those serous membranes. So this very slippery fluid that is secreted is the pericardial fluid, and it reduces friction between the layers of the serous pericardium as the heart is moving. Because remember, the heart is composed primarily of muscle, and its job is to contract. So when the heart contracts, blood is pushed out and gets out to the body. So since we just learned about the pericardium, I thought this would be a good place to talk about a homeostatic imbalance called pericarditis, or inflammation of the pericardium. So let's look at this word again. Remember, I've been talking to you a lot about how important it is to look at words that you might not otherwise recognize. So peri means around, cardi is heart, and itis, anytime you see itis, think inflammation. The most common type of pericarditis is what we call acute pericarditis, and that begins suddenly and usually has no known cause, but in some cases it's caused by a viral infection. As a result of the irritation to the pericardium, there's chest pain that may extend down into the left shoulder and down into the left arm. So pericarditis pain is often mistaken for some of the symptoms of a heart attack. You often have pericardial friction, where it's sometimes called pericardial friction rub, or a scratchy or creaking sound that can be heard using a stethoscope as the visceral layer of the serous pericardium rubs against the parietal layer. So acute pericarditis usually only lasts for about a week or so, and that can be treated with drugs such as ibuprofen or aspirin that have anti-inflammatory properties, or other NSAIDs, non-steroidal anti-inflammatory drugs. You've heard that before, right? Chronic pericarditis usually begins gradually and is longer lasting. There's one form of this condition where there's a buildup of pericardial fluid, and if a great deal of this fluid accumulates, it can be life-threatening because the fluid can compress the heart in a condition that is called cardiac tamponade. As a result of this compression, the ventricles are not able to fill properly, so cardiac output is decreased. Venous return to the heart is decreased, blood pressure falls, and breathing is difficult. In most cases, the cause of chronic pericarditis that involves cardiac tamponade is unknown, but sometimes again it can result from conditions such as tuberculosis or cancer. So treatment usually is also going to consist of draining the excess fluid by inserting a needle into the pericardial cavity and then aspirating that fluid. The heart wall consists of 3 layers: the epicardium, the most external layer, the myocardium, the middle layer, and the endocardium. Endo means in, within, inside, so the endocardium is the innermost layer. The epicardium, as you just learned, is also called the visceral pericardium. So the epicardium allows for a smooth, slippery texture to the outermost surface of the heart. The epicardium contains blood vessels, lymphatic vessels, and blood vessels that supply the myocardium. The middle muscular myo. Anytime you see myo, think muscular. So the myocardium is responsible for the pumping action of the heart, and it's made up primarily of cardiac muscle tissue. So it takes up about 95% of the heart wall. Cardiac muscle fibers are arranged in bundles that swirl diagonally around the heart, and therefore with those muscle fibers running in many different directions, it's able to generate the very strong pumping actions of the heart when those muscle cells depolarize and contract. The cardiac muscle cells are also striated, like you saw with skeletal muscle, but unlike skeletal muscle, cardiac muscle is involuntary. The innermost endocardium is a thin layer of endothelial cells overlying a thin layer of connective tissue, so it provides a smooth lining for the inner chambers of the heart and also covers the valves of the heart. The endocardium is continuous with the endothelial lining of the large blood vessels that are attached to the heart as well, so the inferior vena cava, superior vena cava, the pulmonary trunk, and the aorta. Myocarditis, muscle, heart, inflammation. So myocarditis is an inflammation of the myocardium that usually occurs as a result of a complication of a viral infection or rheumatic fever, or even exposure to radiation or certain chemicals or medications. Often, though, myocarditis has no symptoms. However, if symptoms do occur, they can include fever, chest pain, irregular or rapid heartbeat, fatigue, joint pain, and breathlessness. Myocarditis is usually mild, and recovery usually occurs within 2 weeks, but severe cases can lead to cardiac failure and death if not treated. Endocarditis refers to an inflammation of the endocardium and usually will also involve the heart valves more so than the lining of the chambers. Most cases of endocarditis are bacterial, so we call them bacterial endocarditis. The signs and symptoms of endocarditis include fever, irregular and rapid heartbeat, fatigue, loss of appetite, heart murmur, night sweats, and chills. Treatment for endocarditis is usually effective with intravenous or IV antibiotics. A lot of things are labeled in this image, and you're going to learn a lot of these blood vessels when you are studying the heart anatomy in lab. So right now we want to focus on some of the major structures. The heart's made up of 4 chambers, 2 upper receiving chambers, the right atrium and the left atrium, and 2 lower ejecting chambers, the right ventricle and the left ventricle. The paired atria receive blood from blood vessels, returning that blood to the heart. Those vessels are called veins. So, silly memory trick, veins, V-E-I-N, are going to bring, there we go, V-E-I-N brings blood back in to the heart, and arteries start with an A, arteries take blood away from the heart. So the atria are going to receive blood that's returning to the heart through those veins, and the ventricles eject blood from the heart into arteries that take blood away from the heart. On the surface of each of the atria, there are little pouch-like structures called auricles. So I often teach this in lab. It looks like a floppy little dog ear. Auricle means ear. So these increase the capacity of each of the atria so that it can hold a little bit more of greater volume of blood. Also on the surface of the heart are grooves that we call sulci. So, excuse me, here you have a coronary sulcus, and here you have part of the coronary sulcus. So the sulci or sulci, you may hear it pronounced either way, singular is a sulcus or sulcus, are going to be little indented or grooved areas that contain blood vessels and a pretty good amount of fat. But they mark the external boundary between 2 chambers of the heart. So the deep coronary sulcus encircles most of the heart and marks the external boundary between the superior atria, remember these are your atria, and the inferior ventricles. So the coronary sulcus is going to have the blood vessels and fatty tissue lying in the grooves that separate the upper chambers from the lower chambers. The anterior interventricular sulcus think about what it means. Anterior on the front, interventricular between the ventricles. The anterior interventricular sulcus is going to be a shallow groove on the anterior surface of the heart that marks the external boundary between the right and left ventricles. The posterior interventricular sulcus, just like we saw with the anterior, is going to be on the posterior surface, and it marks the boundary between the ventricles on the posterior aspect of the heart. All right, again, there's a lot of things on here that you're going to learn when you learn the heart as we continue talking more about the heart, but a lot of this you will cover in your lab study. So here you see a posterior view of the chambers of the heart. Here's your left atrium, your right atrium. There you can see that posterior interventricular sulcus where you have your major blood vessels and also a lot of fatty tissue. So that is the external marking of the interventricular septum. Remember, septum is a divider between your right atrium or your right ventricle and your left ventricle. So the right atrium forms the right upper part of the heart, and it receives blood through three veins: the superior vena cava, the inferior vena cava. Now both of these vessels are going to be returning deoxygenated blood from areas below and above the heart. So the superior vena cava brings deoxygenated blood back to the right atrium from areas above the heart. The inferior vena cava brings deoxygenated blood back to the right atrium from areas below the heart. And if I pop right back to this slide, here's the third vein. This is the coronary sinus. It's going to bring deoxygenated blood back to the right atrium from the heart walls itself. So the heart has to have a blood supply as well, and we'll talk about that as we continue to go through this. Once the right atrium fills with blood, the pressure of that blood pushes against the tricuspid valve. The tricuspid valve then opens and blood flows into the right ventricle. The right ventricle then will fill and contract, and when it does so, it's going to push blood into the pulmonary trunk, and from the pulmonary trunk through the pulmonary valve. The pulmonary valve then will open because the blood is pushing against it, and just like swinging doors, it opens one way. You push against it and it opens away from the push. So the valve pushes open and the blood flows into the pulmonary trunk, which then branches into the right and left pulmonary arteries. Now your right and left pulmonary arteries, pulmonary should tell you that, of course, that is headed to the lungs. So artery, A for away, pulmonary, to the lungs. So your right and left pulmonary arteries take blood away from the heart out to the lungs, where we drop off CO2 and pick up oxygen. At that point, the blood is going to U-turn and come back. Just one second here. There we go. It's going to come back to the left side of the heart. Now the right side of the heart, remember, was your pulmonary circuit. So blood came back into the right atrium from the body, then into the right ventricle, which pushed that blood out to the lungs to drop off CO2 and get oxygenated. Now that oxygenated blood comes back through your left and right pulmonary veins. Notice these are red even though they're veins. You may have been taught in school that arteries are red and veins are blue. Well, that's not correct when you're talking about the pulmonary arteries and veins, because red and blue simply illustrates whether or not the blood is oxygenated. So the deoxygenated blood that came back from the body goes through these blue vessels, which are pulmonary arteries. The oxygenated blood comes back to the left side of the heart in these red colored vessels because the blood is now oxygenated. So your left and right pulmonary veins empty into the left atrium. That left atrium fills with blood and pushes against the bicuspid valve, which then opens and the blood flows into the left ventricle. Now once that blood is in the left ventricle, that left ventricle fills, it's going to contract, and blood pushes against another swinging door. That is your aortic valve. Your aortic valve opens when that pressure of the blood pushes against it and blood goes into the aorta. Now the aorta is the main artery taking oxygenated blood away from the heart and out to the body. So you'll notice it's a very large vessel. That ascending aorta goes up, then the aortic arch, and then the descending aorta goes all the way down into the abdominal cavity where it splits to form your left and right iliac arteries. Now let's look again at this aorta. You'll notice there are 3 branches that extend off the aortic arch. That's going to take blood to areas above the heart. The descending aorta has branches that branch all off of that as it goes down behind the heart, through the thoracic cavity, through the diaphragm, and then down into the abdominal cavity. You have branches that go off that descending aorta to take that oxygenated blood out to the tissues that are beyond the aorta. All right, now I do want you to notice something here. Look at the walls of the right ventricle as compared to the walls of the left ventricle. You should notice that the left ventricle is much thicker, so the myocardium, the muscle, is much thicker on the left. Why do you think that is? If you look at this cadaver heart, it's really obvious. There's your left ventricle, there's your right ventricle. Now, your left ventricle, the left side of the heart completely, is your systemic circulation pump. So systemic means of the entire body. So the left side contracts and pushes blood out into the aorta and then out to the entire body. Okay, let's think about the right side. The right side contracts and pushes blood out the pulmonary trunk out to the lungs. So if you think about it, just that right side is just psh, 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 pushing blood out to the lungs. Not that far from the heart, right? So it doesn't take really strong contraction. The left side, think about, instead of psh, 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 it's more of whoosh, whoosh, that big hard contraction, having to push blood with enough pressure to get it all the way to the tips of your toes, the tips of your fingers, and the tops of your head. So the left ventricle muscle works much harder than the right. And we all know what muscle does when we work it hard. You build more muscle, right? So the muscle gets bigger and stronger. And that is why you see such a difference comparing the left ventricle or the right ventricle with that thick, meaty left ventricle. When the chambers of the heart contracts, it pushes a volume of blood into a ventricle or out of the heart into an artery. Valves open and close in response to pressure changes as the heart contracts and relaxes. So each of the 4 valves that we just had an introduction to, the bicuspid and the tricuspid, the pulmonary and the aorta, have a one-way flow. So they allow blood to flow through and then they close to prevent backflow. Because they're located between the atria and the ventricles, the bicuspid and tricuspid valves are called atrioventricular valves. So we sometimes just say AV valves. So I'm going to just say AV. Now when an AV valve is open, the rounded ends of the cusp project into the ventricles. So as you see here, the AV valve would be sitting with the atria up, or the atrium up here, the ventricles down here. So the cusp are projected down into the ventricles. When the ventricles are relaxed, the papillary muscles are relaxed. The chordae tendineae are not being pulled on, so blood moves from a higher pressure in the atria into lower pressure in the ventricles through those open AV valves. When the ventricles contract, the pressure of the blood pushes the cusp back up, and then their edges meet and they close the opening. At the same time, the papillary muscles contract, and as I mentioned a while ago, that pulls on and tightens the chordae tendineae. This prevents the valve's cusp from everting or opening back into the atria in response to that high ventricular pressure. If the AV valves or the chordae tendineae ever get damaged, then the blood may do something we call regurgitate or backflow into the atria when the ventricles contract. The aortic and the pulmonary valves are what we call semilunar valves. Semi means half, lunar refers to moon-shaped. These are made up of 3 crescent moon-shaped cusps. The semilunar valves allow for ejection of blood from the heart into the arteries, but prevent backflow back into the ventricles. So when the ventricles contract, pressure builds up within their chambers. The semilunar valves open when the pressure in the ventricles exceeds the pressure in the arteries, the pulmonary trunk, and the aorta. So this permits ejection of the blood from the ventricles into that pulmonary trunk and the aorta, and then out of the heart. So as the ventricles relax, the blood starts to flow back toward the heart, and some of that blood then bounces on the cusp of those semilunar valves and forces them to close even more tightly, and that prevents backflow back from those major arteries into the ventricles. Thinking about what we just talked about with the way the blood is being pushed from the atria through the AV valves and into the ventricles fill and then push the blood through the semilunar valves, it should be obvious to you that when one set of valves is open, the other set is closed. So if you look at this particular picture, okay, so we have the pulmonary and the aortic valves are closed. So remember, those are the semilunar valves, and those are the ones that allow blood to be pushed out of the ventricles. So if these are closed, that means the ventricles are filling. So your atrioventricular valves, your bicuspid valve, and your tricuspid valve are open. So the ventricles are filling. When the bicuspid valve and the tricuspid valve are closed, that means the ventricles are contracting and pulling on those papillary muscles and chordae tendineae. So the ventricles are contracting. That means we need to send blood out through the pulmonary trunk and the aorta. So your semilunar valves are open, your atrioventricular valves are closed. When heart valves are operating normally, as they should, they open and close completely at the right time. A narrowing of a heart valve opening that restricts blood flow is known as stenosis. Stenosis means narrowing. Failure of a valve to close completely is called insufficiency or incompetence. In mitral stenosis, scar tissue forms or a congenital defect can cause a narrowing of the mitral valve. One cause of mitral insufficiency, where it allows backflow from the blood from the left ventricle back into the left atrium, is mitral valve prolapse. In mitral valve prolapse, one or both of the cusps of the mitral valve protrude into the left atrium when the ventricles are contracting. It's one of the most common valvular disorders, affecting approximately 30% of the population. It's also more prevalent in women than in men, but usually doesn't pose a serious threat. In aortic stenosis, the aortic valve is narrowed, and in aortic insufficiency, there's backflow of blood from the aorta into the left ventricle. Certain infectious diseases can destroy or damage the heart valves. One example of that is rheumatic fever, which is an acute systemic inflammatory disease. It usually results from a streptococcal infection of the throat. So, pretty serious, right? Get that strep throat treated. The bacteria trigger an immune response, and the body produces antibodies that should destroy the bacteria, but instead of destroying the bacteria, when they attack, the connective tissue also becomes inflamed. So connective tissue in the joints, the heart valves, and other organs. So even though rheumatic fever may weaken the heart wall, it most often damages the mitral and aortic valves. If daily activities are affected by these valvular disorders, or if a heart valve can't be repaired surgically, then valve replacement must be done. Tissues may be provided by human donors or even pigs. Pig valves are very common. Sometimes